are Team A, and our team consists of Andy Doyne, Stephen White, Brennan Bogner, Kelly Smith, and Shaniqua Robinson. Our team was assigned the task of defining and explaining what ISO is. ISO stands for International Organization of Standardization and was created to make sure that products and services are safe, reliable, and of good quality. They help companies access new markets, level the playing field for developing countries, and facilitate free and fair global trade. You might ask, what is a standard? A standard is a document that provides requirements, specifications, guidelines, or characteristics that can be used consistently to ensure that materials, products, processes, and services are fit for their purpose. Planning for ISO began in 1946 when a group of individuals from 25 different countries met in London in an attempt to bring a universal standard to industrial-based standards. In 1947, ISO officially started its operations. Currently, there are 162 member countries that provide experts, with 150 people working full-time in the headquarters at Geneva, Switzerland. Pictured are the original founders of ISO in 1946. So what does ISO actually do? ISO creates standards or specifications for business practices, consumer goods, manufacturing processes, etc. These broad categories are broken down specifically by industry, with healthcare being one of the subcategories. ISO standards are created by an international panel of experts with the hope that these standards will be adopted by the world at large. Told these folks look hard at work creating the next standard. International standards have led to economic and social benefits throughout the world. In the business realm, ISO helps companies operate efficiently and produce quality products. High volumes of sales are driven by increases in customer satisfaction. Controlling the quality of products can help negate the harmful impacts on the environment. Examples include creating standards on air, water, soil quality, and emission of gases. ISO has also opened up world trade because many governments in various countries have adopted these regulations, ensuring universal standards in the quality of imports and exports. There are 1,200 health-related ISO standards, including standards regarding surgical equipment, health informatics, and interoperability between systems. There is even an ISO standard for traditional Chinese medicine. Part of the funding for ISO comes from the sale of these standards, so unfortunately Group A will not be using the ISO standard when we look for our EMR for our traditional Chinese medicine independent family practice. Just kidding. Thanks for listening.
Good evening. My name is Matthew McCarty, and I will be representing HSPM 713 Team B, consisting of myself, Amanda Kitchings, Anya Busher, and Dustin Huang, and giving a short presentation on current procedural terminology, or more commonly known as CPT codes. In this presentation, I will discuss the need for standards in healthcare diagnosis, what a CPT code is, how they work, and how they are updated to keep up with the changing technologies. So why do we need standards? Standards are an everyday part of our lives. Most we don't even notice. For example, we go to the farmer's market, and let's say they're selling apples by the pound. However, there are several types of apples, each of which may be priced differently. If there is no price per pound on the apples, and you charge the customer ahead of me $1, but you charge me $1.50, it is obvious I'll be fairly displeased with this. Now, why as a society do we disapprove of selling apples at different prices without clarifying their specific type, yet do not accept this practice in healthcare? Standards are one way to help with this issue. Now, who is responsible for creating the type of medical standards needed worldwide? Is it the United Nations? Individual governments? Apparently, almost anyone can, even professional organizations. This is how CPT codes started. So what are CPT codes? The CPT code set is a medical code that was developed and maintained by the American Medical Association and describes medical, surgical, and diagnostic services. It was constructed to assist in the communication of medical services and procedures among the players in healthcare, such as physicians, coders, patients, accreditation organizations, and payers for administrative, financial, and analytical purposes. The current edition of the CPT code set is the CPT code 2014. There is a standard edition and a professional edition. Procedure codes are also within the ICD code set, but they are only used in the inpatient setting. So how do CPT codes work? There are three types of CPT codes: categories 1, 2, and 3. Category 1 codes are the 5-digit numeric codes that are most familiar to individuals in healthcare when discussing CPT codes. These codes are consistent with current medical procedures that are widely performed. Category 1 codes must be approved by the FDA, and the procedure's clinical efficacy must also be proven and documented. These codes are updated annually and broken down into 6 sections, these being evaluation and management, anesthesiology, surgery, radiology, pathology and laboratory, and medicine. Category 2 codes are used for the tracking and performance of management. They are used to keep up with HIPAA performance measurement regulations as well. These codes are helpful in collecting data about the quality of care given to patients. Category 2 codes are alphanumeric and consist of 4 digits followed by the letter F. Searching for a Category 2 code helps to decrease the time searching for a certain procedure that has been done numerous times in a hospital. Category 3 codes are temporary codes used to track utilization of new technologies. Unlike Category 1 codes, these do not have to be FDA approved, have proven efficacy, or classify procedures that are commonly used. Instead, these codes must be used for procedures that are involved in ongoing research. The codes are used to track emerging technology and services as they gain popularity. Category 3 codes all have 4 digits followed by the letter T. The codes are temporary and will be discarded if they do not qualify as Category 1 codes within 5 years. So how do we keep up with the changing technologies? CPT codes are updated and kept by the American Medical Association's editorial panel. This group meets 3 times a year to discuss new procedures and technologies for which new CPT codes have been applied for. This slide represents the process for requesting a new CPT code. This is generally requested by educational hospitals and private physicians which have developed new techniques, technology, or diagnoses which they feel are not adequately represented under the current CPT code listing. After initializing the request, the AMA editorial panel will evaluate the request and determine if there needs to be a new CPT code generated. If not, the panel will inform the requesting party that the code they have determined is representative of the requester's procedure. If the panel does determine a new CPT code is necessary, the requesting party will be informed of what code to use in the interim until a new code is published. In conclusion, standards are about making sure that different parts of a complex system can work together effectively. CPT codes are just one of the many examples of these kind of standards. Though these codes may not be the perfect solution, it seems that they will be the standard for describing medical, surgical, and diagnostic services for the foreseeable future. Thank you for your time, and have a
Diagnosis-related groups, also known as Drgs, are a means of classifying a patient under a particular group where those assigned are likely to need a similar level of hospital resources for their care. This allows hospital administrators to more accurately determine the type of resources needed to treat a particular group and to predict more closely the cost of that treatment. In an effort to quantify hospital care, the system was developed in 1982 by Robert Fetter, Yale School of Management, and John Thompson, Yale School of Public Health, both in New Haven, Connecticut. The system was to be used to help hospital administrators ultimately control physician behavior. The DRG system, comprising approximately 500 groups, takes account of all patients admitted to acute care in the hospital. Each DRG has a payment weight assigned to it, allowing the hospital to determine how much it can charge for its services. Weighting is based on a hospital's geographic location, whether or not it's a teaching hospital, the percentage of low-income patients in the group, and whether a particular case is more expensive than usual. By its nature, the DRG system creates more opportunity for medical facilities to benefit financially from maintaining accurate documentation. Deciding on the most appropriate DRG level to assign to a patient is determined by several factors, including the International Classification of Diseases, code Are codes recorded during the hospital admission. There are generally 3 levels of major disease categories, with a higher weight given for the more serious illnesses. ICD diagnoses are assigned to one of 3 categories: neutral, comorbid condition, or major comorbid condition. The DRG serves as the cornerstone for hospital reimbursement, whereas the higher the acuity, higher the weight, higher the reimbursement. Now I would like to leave you with 4 guiding principles for DRG formation. 1. Patient characteristics used in the DRG definition should be limited to information routinely collected in the hospital billing form. 2. There should be a manageable number of DRGs that encompass all patients seen on an inpatient basis. 3. Each DRG should contain patients with a similar pattern of resource intensity. And 4. Each DRG should contain patients who are similar from a clinical perspective.
Good afternoon, we are Group D, and today we will be talking to you about Sno-Med CT. Sno-Med CT stands for the Systematized Nomenclature of Medicine Clinical Terms. It is a systematically organized computer processable collection of medical terms providing codes, terminology, synonyms, and definitions used in clinical documentation and reporting. It was created by CAP, the College of American Pathologists, to represent medical terminology in electronic health records, and is now owned by the International Health Terminology Standards Development Organization. Sno-Med CT is the most comprehensive and multilingual clinical healthcare terminology in the world. It consists of 4 primary core components. 1. Concept codes. Numerical codes that identify clinical terms organized in hierarchies. 2. Descriptions. Text descriptions of concept codes. 3. Relationships. Relationships between concept codes with relating meaning. And 4. Reference sets, which are used to group concepts or descriptions into sets. Now to get to Sno-Med vs Icd. To start with, Sno-Med is a clinical terminology designed to capture and represent patient data for clinical purposes. Sno-Med CT is a clinical terminology designed to capture and represent patient data for clinical purposes. ICD is a statistical classification system used to assign diagnostic and procedural codes in order to produce coded data for statistical analysis, epidemiology, reimbursement, and resource allocation. Both systems use standardized definitions and form a common medical language used within the EHR systems. To keep it short, Sno-Med CT is intended for information input and describes and defines clinical information for primary data purposes, while ICD is intended for information output and aggregates and categorizes clinical information for secondary data purposes. Some feel that you shouldn't choose Sno-Med over ICD because it's too detailed to be used for reporting. For example, ICD-9 has about 14,000 code, ICD-10 will have about 68,000 codes, while Sno-Med CT has about 100,000 codes. Some feel that Sno-Med should be used to help with the transition to ICD-10, so Sno-Med is not considered to be superior to ICD because they are designed for different purposes. Sno-Med is used during the process of care, ICD after the episode of care. There's even mapping that can generate Sno-Med codes into ICD-10 codes. It can be used as a common language between ICD-9 and ICD-10, and ICD-11 is supposed to be very similar to Sno-Med. So implementation of Sno-Med in EHR can not only help the transition to ICD-10, but it can also improve the quality of care, and is suggested to be the standard for stage 2 of meaningful use. So whether you think Sno-Med is too detailed to be useful, or is better than ICD, or it should just be used alongside with ICD, it is an important system for now. It's important because of the requirements of meaningful use and its potential to help achieve them. We hope this short presentation has helped you gain a better understanding of Sno-Med CT. There's still much more information out there, and if you're still a little lost on the subject, just remember, even the professionals are still confused.
Hello everyone, we are Group E, and today we're going to be talking with you about ICD. ICD, the International Classification of Diseases, is the standard diagnostic tool for epidemiology, health management, and clinical purposes. It was designed to promote international comparability in the collection, processing, classification, and presentation of mortality statistics. ICD was triggered by the recurring problem of determining the causes of death in many countries. On January 1, 1901, ICD-1 was implemented. Currently, WHO, the World Health Organization, maintains the ICD ontology. The United States uses ICD-CM, International Classification of Diseases, clinical modification. The clinical modification is used to support disease concepts for medical billing. This ontology is maintained by the CDC. When comparing ICD-9 to ICD-10, it is easy to see that ICD-10 is far more extensive than ICD-9. ICD-9 has 13,000 codes, whereas ICD-10 has 68,000. There is more information conveyed in ICD-10's codes, and currently most countries use ICD-10. ICD-10 codes are 3 to 7 digits in length and tell much more about patient information, whereas ICD-9's codes are 3 to 5 digits in length. ICD-11 is in development and will be released in 2017. ICD-11 will use a web-based platform equipped with web-based editing, multilingual capabilities, and definitions of signs and symptoms will be defined in a structured way to increase accuracy. ICD-11 will also be compatible with EHR information systems. In conclusion, ICD is used by physicians and hospitals to indicate diagnosis for all patient encounters. With ICD, countries can compare health status with minimum variation. Essentially, it creates a standard.